Yeah, I'm Dr. Robert Cagle. I specialize in hip and knee replacement surgery utilizing robotic technology with the Mako. And I'd like to introduce you to one of my patients here, Gordon.
Over the years, I guess I became pretty arthritic in my hip, and it got bad enough to where I was told that I should really get a total hip replacement. I had that done, not by you, by someone else. At first, it seemed to be very successful, but I developed, as you know, a very terrible infection. I tried, myself and a couple other doctors attempted a few different treatments, none of which were successful, at which point your name got brought up as a specialist for doing something called a two-step revision to finally, hopefully, eradicate the infection.
What a two-stage revision is basically is if you have an infection, which is extremely uncommon, far less than 1% if done in the right hands.
Yeah, I was one of the lucky 1%.
Yeah, but if that does happen to happen, basically you have to remove all of the hardware from the hip joint, and you have to do what's called an antibiotic spacer. So you basically don't have a hip replacement, you have an antibiotic delivering device to try to get rid of the bacteria that have kind of infiltrated into that hip. And then you clear the infection with intravenous antibiotics, and you give it enough time, what's called a drug holiday, which for you was almost 9 months. And then we follow labs and see how you're clinically doing, and then if everything goes well, then you get a new hip replacement.
I was just thinking, I don't want 2 more surgeries. I'm just going to try antibiotics and see how that works. But eventually I get fed up with that because one of the things, as you know, my metal parts were loose. Yeah. And so really with every step I had metal parts grinding against bone, which became pretty awful.
The problem is if infection sets up, it actually forms a barrier on the backside of the metal and prevents that, what we call osseous integration, or where the bone actually bonds to the metal. Right. And then it was almost 2 years that you were on just oral antibiotics.
Yeah, about a year and a half.
Year and a half, yeah. And that was kind of when it got to the point, well, you described like basically you couldn't walk anymore.
Yeah, it was really bad. And that also I did maybe like a 6-week round of IV antibiotics 3 times a day. That wasn't successful. The oral antibiotics were not successful. Plus, who wants to be on antibiotics for the rest of their life? So, yeah, it came to the point where I had to do something.
So that's kind of when you got shifted over to my care, is that right?
Then your name came up.
Mm-hmm. Yeah, and I have one of those abilities where I don't shy away from complex problems, and luckily I have a skill set. So basically that's when we met, and I look at your x-rays and said, these are obviously loose and infected for going on almost 2 years now. There's no way to clear this infection other than with the 2-stage revision. So we remove all the parts. That was in March of 2020. But luckily for us, we did a good clean out, got the antibiotics on board after we removed all the metal, and we followed your labs for months. And then December came around and said, okay, it's time to give him a new hip. And that was with the Mako robotics. So that's why we had to get the CT scan. And that was after we were very, very certain that the infection was cleared. And that has been almost it was December.
More than 2 months.
Yeah, almost 3 months. So how has that been going after you take the antibiotic spacer out and get revised to a hip replacement?
It's been great, actually. Right now, less than 3 months out, I feel like I was never operated on. So
I know infections around hip replacements are extremely rare, but when they happen, there are ways to get it fixed. Yeah. Would you recommend, Dr. Cagle for some?
Absolutely.
For hip replacement or knee replacement?
Yeah, without reservation.
Wonderful. Well, thank you, Gordon. I appreciate you coming in and taking the time, and I'm proud to be your doctor.
All right.
Thank
Thank you.